Okay, so can you hear me, Patrick? Yeah, can you hear me? Can you hear me? Hello? Hello, can you hear me? Hello, can you hear me? Hello? Hello, hello, hello. I can't hear you. Can you please respond? Hello, hello. Can you please respond? Patrick, can you please respond? Hello, hello. Yeah, Patrick, can you please respond? I am unable to hear your voice. Hello, hello, hello. Hello. Yeah, Snehal, thank you. But I'm trying to see if Patrick is also audible and visible to you. Can you please respond, Snehal? Yeah, I have accepted your connection. And it says that I have accepted your connection. Okay. No, you are part of live video, Patrick. It says you are part of live video. Uh, Hello. Hello, Patrick. Hello. Yeah,
Okay,
Patrick,
now I'm live.
yes,
Yes, I can hear you now.
great. Yeah. So can you adjust your screen so you can be visible because your forehead is gone.
Yes, here. Can you see me?
Yeah, I can see you.
Hang on. I need to fix a couple of things. Wait a second.
Okay.
Here.
Okay. Great. Good to see you.
Yes,
Thank you for joining.
finally, it works.
Finally. Finally. So there are people who are here and they some of them are my students and some of them are from my professional circle. So I guess
Okay.
people will join as we move ahead. So let me start uh, with the purpose behind this particular
Mhm.
Instagram live. So I mean we know each other for a very long time now, though we haven't met yet in
That's
person.
true.
Yeah, but
Not yet.
we have been not yet. So we have been working and collaborating online, and we have done in past and doing it also. So this is again one of my attempts to create awareness on workplace well-being, but this time I have chosen Instagram.
Mhm.
And yeah, so I think this platform is new for both of us, and we are trying to explore, but it's a good thing. And there are people who are interested to I mean, I see a lot of good followers and content creators for mental health and well-being on Instagram. So I think it's a really good platform. I'm getting good response for last few days, when since the time I have started using Instagram very regularly. So today's topic, as we have already conveyed to others, is uh, it's about workplace well-being and how COVID has changed our workplaces, and how we can, I mean, post COVID, what can be done to improve the mental health and well-being in the workplaces. So we are going to discuss in both Western scenario as well as in Indian scenario. So in Indian or Asian scenarios, let me correct. So so we are going to discuss the impact of COVID-19 on the mental health in the workplaces. Also, we will be discussing some of the effective well-being that can be implemented both in Western context and Indian context and Asian context, building resilience and coping strategy at individual level, because it's not only the responsibility of organization, it is also responsibility of people who are working for those organizations.
Yeah, of course.
Then what I also, I mean, even this is my experience, that instead of so many communication devices and platforms, we are seriously lacking in communication, and that's why we are not really able to support a lot of people during Corona also, and even after Corona. So that is one of the key points we will be discussing: how to foster a healthy communication, which can be supportive for many, and of course recognizing and addressing the mental health challenges in the workplace, whatever going on. For example, there was a trend of quiet quitting 1 year back. Then there is a lot of burnout. I mean, if you remember, I wrote an article in my mother tongue few days before on burnout, and it was received very well. People really don't understand what has happened to their brains and bodies during Corona. So so let me introduce our guest speaker, Patrick. So Patrick, again, thank you so much for joining me. And I know you are going through a lot, but still you could manage some time for this topic, and you are here now. So Patrick is a good friend of mine who is also an organizational psychologist. He is also a certified clinical psychologist. Yes. And he has been working, I think, for more than 25 years now. It's more than 20, 25
Yeah, you can
years.
see how old I am now. Yes.
No, that's, I won't say that. So he is very vocal about the issues like organizational well-being, workplace culture, especially the burnout issues, and how things can be improved. Basically, so he is a solution provider, and he is an excellent writer. He used to write for Forbes, I guess, a year back, but now I don't know why he has stopped writing. But he is an excellent writer. Good public
I was
speaker.
running out of topics. Basically, Forbes asked me to only work about the workplace, and after 2.5 years publishing every month on the same topic, I ran out of idea. I mean, things change, but not every month. So I took a break, waiting for something forward to happen. So then then I can rejoin again and talk about what's happening now.
Okay. Yeah, I look forward for that, because I used to enjoy your articles. You used to post on LinkedIn, I guess. So he is a member of American Psychological Association. He's also a senior advisor to the Organizational Psychology Board at Hong Kong Psychology Association. He is a member of Forbes Business Council and contribution. He was a contributor to Forbes magazine.
Forbes, yeah.
He's a member of Mental Health Europe and expert on
I
organizational
was.
change in Europe.
I just I was recently. I stopped that. Different. Too much politics. I'm a man of action, so I don't mind talking, but I need to see some action eventually. And when people talk for many years and there's no action, this is where I say goodbye,
Yeah.
and I continue doing my action.
Okay. He's also a member of International Association for Counseling, a branch of United Nations. I think you have worked with United Nations.
I was not
And
with, but yeah, in collaboration. And yes, I was part of the counseling branch, the counseling psychology branch of the United Nations.
and also, since he is a Canadian,
Mm.
he's also a member of Canadian Counseling and Psychotherapy Association. So he has an extensive experience in psychotherapy and
Yeah,
counseling as well. Sometimes I also take help from him. He knows. Yeah.
that's true.
So this is about Patrick, and today I think I look forward for this conversation because it's been a very long time that we haven't done a session together.
Yes.
We did on LinkedIn, I guess, a couple of months back, but we were both in a different phase. So I guess
Hmm. Hmm.
this is going to be something really good. I look forward to. So over to you, Patrick. I guess our first point, that is the workplaces during COVID and post COVID, how things are going around the world. Please enlighten us.
Thank you for the long and very precise introduction. Things moving all the time, and likewise, I really value everything you do. I mean, you write many books and things, so I'm really, really happy to be friends first of all, and we working on the same topic. Yes, to answer your question, not an easy question to answer, but what I can tell you is COVID worked as a catalyst, as an accelerator of what was about to happen. But instead of happening in the next 20 years, it happened all together in 2 years. Basically, the first thing was the consciousness of people that sooner or later will realize that the way we work, the way the society have constructed our life around the work, instead of constructing our life around life and work being a satellite of it, we have constructed our life around the main centerpiece, which is money. Money means work, work means things, and then we're trying to survive around that centerpiece. And what COVID um, um, brought to us, it brought that we shifted the centerpiece with our life first and work maybe. Um, but for centuries, it was always work for, work first and life maybe. So that shifted completely, and that sent uh, a ripple effect across many industry and have consequences still today, and will have consequences for a very long time. I'm very glad that thing happened because it was meant to happen, and I'm glad because for one, I can see the change while I'm still alive and still capable of doing some change and helping the change. And two, because it was necessary for a very long time. Many people were struggling. They didn't realize they were stuck in this loop, in the loop where they wonder when eventually it's going to derail. Like you in a loop, you go fast and faster and faster and faster. Eventually, you're going to derail. There's no other choice. It's gravity. It's like centrifuge force. It's going to happen, and it happened during COVID. But so what happened is many people had time to think, and when they had the time to think, then they say, "Oh my God, this is my life," and I was born to what? To work? No, sorry. Maybe I was born to do something else. So, and then what happened? COVID passed. 2 years more or less. We concentrate on the disease mainly. And then there's another thing that happened, like I call it perfect storm. Not that a bad thing. Came a new generation on the workforce, the Gen Z. And when they arrive, mainly after COVID, well, before, but I mean, mainly massively after COVID. And the mindset have shifted together with the new generation. As we say, non-politely in English, the shit hits the fan. And the two together have sent a lot of managers from the old school wondering how they're going to manage the thing. So what they did first, they say, okay, COVID is over, bring everybody back to work so we can continue lashes the people like the Egyptian that that built the pyramids. And the generation responded, sorry, lashings what? No, sorry, we don't do that anymore. So they imposed that and people quit. They quit and become digital nomads. It was about 3 million of digital nomads before COVID. And a couple of years after COVID, just now, there's about estimated 50 million. So it went from 3 to 50 million. These people that quitted their workplace with a firm intention to never return to the workplace, doesn't mean that they have no intention to work. They want to work without the conventional. They're usually very educated. They earn good money online, and they start to live their life as they wanted to. These 50 million people today that are doing the work, some work for big organization as a remote, and some work for themselves or between the remote workers that we call digital nomads. When we will have enough people, let's say 100 to 200 million of them soon, because it's going exponential, there will be enough of those people to make business between themselves and leave the normal corporate world. Now, the corporate, if I was I read an article this morning, Nike CEO today, so that's news from today, Nike CEO blame COVID and blame especially the remote workers, and he has imposed the return to work, ROT, the return to work, RTO, return to the workplace. I mean, I don't know how they call it. Yeah, something like that. And he says, well, we cannot be creative on a distance. Oh, yeah, back to the office. I mean, they have money appellation for that. So he basically said today in an article that Nike is no longer attractive because they haven't created something new for quite some time. So people are kind of going away. And of Nike brand, they lost quite a few percentage of sales to newer brands, especially from China. And so they're not very happy, of course. And they couldn't find anything else to blame than the remote work is saying we cannot create like that. We have to be on the same room together night and days, eating pizza until 3 a.m. That's the only way it works. No, that's the only way it used to work. Not because it was the best way, it's because it was the only way known to mankind until we try something else. And now we try something else, we know that's working. So NVIDIA, the biggest company in the world for now, because of the AI things, which have a massive remote workforce, has replied to Nike today saying, well, we are very creative and no one is at work. We're working remotely from all over the world. So then creativity and being remoted has nothing to do with each other. And now we're waiting for what Nike's CEO is going to reply to that. So it's interesting time. I'm very happy to be in this interesting, challenging time, but interesting time where everything has changed. And my little role in this plan is trying to guide the change into something called the future of work. No one knows for sure. I'm not, a divination thing. I don't have a tarot card to know what will happen in 5, 10 years, 20 years from now. But you can see the trend that already started today will not come back to, for sure, we're not coming back to the past. That's certain. Where exactly are we going with AI? And there's another storm, the perfect storm. AI is coming more than ever. So with the mentality shift, new generation, and AI coming stronger than ever, replacing in many cases people's job, it's going to be very interesting to see where we're going. So our role, you and me, Vrushali, as organizational psychologists, we just get started, and that's
Yes.
a good news.
Yes. Yeah. Yeah. Thank you for those observations and insights. In Indians contest, I think I may say few points, because even I am not aware, because we are not very good at tracking the data in India.
Mm.
So lot of things have happened. Though I have wrote a book, I have published a book during second wave of COVID.
Yeah.
So it is all about workplace and how Indian workplaces, change and have been changing. So, in India, 90% workforce is unorganized. And people who are like me, who have been associated with IT industry or ITS industry or corporate, we can say, the sophisticated, people, you call white collar, right? I mean, blue collar
Mm.
and white collar people. So who are working with the desktop and laptop kind of people. So they had a different set of issues. Okay. And people who were not in organized sectors, like farmers, or even people from manufacturing sector who used to work with machine, like even the uh, small shopkeepers,
Mm.
small and medium MSMEs, entrepreneurs. So most of them have faced, first of all, for the economical part, which is money crunch,
Mm.
because of the lockdown and economical condition, especially because of the lockdown where people were locked in the houses, and it was not possible for them to go to the factory and work. So there were a lot of laid off, and like you said, organizational change was there, and it was supposed to happen, like you said, in 20 years, but it happened in last 3 years. So
Mm.
yes, the organizations have changed in terms of work pattern. People had, I mean, they laid off people. So the economical impact is massive. I mean, in India, it is massive. And even for people like me who are working in a sophisticated jobs, corporate job, there was a layoff, and there is a layoff still going on. So somebody, 2 days before, somebody told me that a friend from HR. So he told me that he laid off almost 60 people in a
Mm.
go, and then company also fired him.
Mm.
So 60 people is not a joke, and some of them, like he told me, were pregnant ladies. I mean, he was totally shattered, like laying off, and it was first time for him. So I think this kind of layoff, plus working from home, it was not a pleasure activity, at least for Indians. I mean, for Indian homes, I mean, you had been to Thailand with your, wife and family. So similar conditions are in India. So we don't have big homes like Europe or, Canada or Australia or USA. We have small homes, and 4 and 5 people are living in that kind of home. And where
Mm.
there is a when we used to be in a pre-COVID era, we had our own private space, because there was a very less time people used to come together, maybe during night time. But then during COVID, all of them had to stay in one place, in a small place, even it's a 800, or even I'm I'm staying with my mom. So
Mm.
even for, and we have a pretty comfortable home, but still we face this issue that you can't live together for that long, like 24 hours you can't live with your family. So you used to have compartments, like you have a office, and within office also you had friends, maybe you had friends from other offices in the same building. So it was a big circle. So mental health issues were less, and like you said, we actually confronted ourselves, our fears, our anxieties, our mostly negative emotion we faced during COVID, when we were living with ourselves and our family for a consistently long duration. So mental health issue are alarmingly high in India, and people really don't understand that they are facing anxiety, they are facing stress, they are facing depression. Addiction is also all time high in India. So I
Not
can
only in
say
India, like really everywhere in the world, Vrushali. Like America, the US have sound the alarm of mental health. Yes,
yes,
I know it's everywhere.
yeah. So COVID has, like you said, COVID it forced us to work from home, but then it impacted also our social life and thus our mental health. So because we are social creatures, and like you said, Nike and Nvidia, but it may work for some sector, but it may not. It will not necessarily work for other sectors because we are
Hmm.
so used to see each other face, and the touch part is there. So touch deprivation, because of even touch deprivation, mental issues can we can have mental health issues. So all these factors, we stop traveling, we stop having picnics and all those things, we stop going into the nature also. So that all impacted our mental health. And the most important factor I would like to add here, as an Indian, is the trauma part. Western countries, especially developed countries, are aware about the trauma, the PTSD, which is post-traumatic stress disorder,
Hmm.
and the grief associated with the death of loved ones. So I also experienced grief because I lost my father untimely in first wave of corona. So, and then I had to take care of my mother because she was also going through difficult times, because it was not it was not easy for her to accept the death and move, especially in the old age. So I guess India is still unaware about the trauma part, and whatever happening currently is post-traumatic. I mean, it is happening after a trauma. So trauma is gone. So COVID is gone, but the effect of COVID is still lingering
Yeah,
in form of
it takes for the brain, right? It takes about 1 to 2 years to to process the trauma.
exactly. So the trauma part, and it is complex trauma. I would say it is complex PTSD because there were so many things happen. Apart from living under the fear of death, we experience job loss, we experience financial trouble, we experience social isolation. So multiple things happen, and that is the complex trauma part and the grief part, because not
Mm.
only me but so many of them have had lost their loved ones. I know some of the people who lost, I mean, they are staying only, I mean, they have lost the family, complete family.
Mm.
I know one lady, she had lost both, I mean, mother and father, and her only brother also. So that is really, I mean, I don't know how she is coping with it, but the PTSD part, that the stress followed by the trauma, as you said, it is going to be for next 2 3 years to come over, if at all they get a proper treatment, because that is
Mm.
also important. And that's why where our role is important, to guide organization that help people with who are traumatized, and people who are dealing with grief. Grief is something we experience, it's an emotion we experience when we lose someone, when there's a death of we lose someone because of death. So these are, I think, few points I wanted to add. I
Hmm.
think we can go to the next point, which is about the initiative part. So what kind of initiative as an organization psychologist would you like to suggest, considering all these factors,
Mm.
well-being initiatives in the organization?
The first thing I would say it's the awareness, not from the workforce, not the employee, but the employer. Remember that the workplace was created as a place that use the skill set, the time, um, the invention, the creation, the creativity of the people. They create a product, a service, a product. I often take the car. Okay, so I'm going to create a new brand of car, and I need a big factory, money factory, and in many side parts, I need a lot of people, engineer, all kind of people. I didn't pay for the training. I just employ them for the time being, for as long as they work with for me. I create a car that make me rich, not them, make me rich. And then what happened to the car 20 years down the line when it's done, and all the leaking part and all the rusty part, and who's taking care of that? Not me. Me, I use the people, I create something, I sell to make money, and what happened to that product in 20 years, not my problem. All right, so once you understand that, it was the same for the mental health. I'm going to squeeze you like a lemon while you work for me for a small salary. And what happened to you if I squeeze you too hard? If in the meantime, while I'm pressing you, you have also death in your family, other things, not my problem. And what the new generation are saying, say, yes, your problem. You're part of the problem, so you become part of the solution. That is new, completely new for managers. This is, they heard that for the first time. Some of them, most of them, heard that 2 years ago. Like they didn't imagine they could be part of the mental health. So basically they're saying, are you telling me we damaging the people? Yes, you do. And they say, how? Well, because we spend 10 hours a day at your place. Who do you think is more damaging? So that first awareness, I will say, is there, but not there yet. We're on the way. It's not accepted. It's a bit like climate change. Not everyone accepts that we have done something to the climate. Many people believe that no, it's natural things. And it could be both. But yes, we definitely have something to say. Well, the denial is still there in the workplace among the people, and they never heard of we part of the problem. And why should I invest in part of a solution since I didn't create a problem? So really, we're still there. Sadly, we're still in the first base here. Once we pass that and we all accept, or the CEOs of the world accept that, yes, we damage the people, so let me give you the cure or be part of the cure, then what can we do? First of all, they will have to adapt to the way we work today. So they used to dictate the way we work. They used to dictate where we work. They create big city this way. So people move from their countryside to the city because it was the only place where there was a job. Now we don't have to do that. They used to move to a country, to the Silicon Valley, for example, asking for US immigration, not an easy thing. To get it, not an easy thing. And to live in the US, not easy as it seems. We don't have to do that anymore. You can still stay at your farm, in your multi-level family farm, and you can support your family, your grandfather, your grandmother, and working from that farm in Afghanistan for the Silicon Valley, pay in US dollars, almost as if you were living in California. And that is something new. So the workforce is more diverse. They're not aware of that, or very little aware of that. They need to be aware that they're part of the problem. They're about to become aware of that. And what can we do is to educate, basically. That's what I call it, guide or educate, or translate. Sometimes I use the word translate between what the new generation, because old generation, as they intend to do, they get older, not younger, and they're going to eventually retire or even die. That's normal life. And so who's taking over? Always the young generation taking over. Always. That's the way life is all about. It seems they don't get it. I will not talk about politics in this thing, but if you see what's happening in politics around the world, those 75 plus years old leaders, it seems they don't get it, that their time is almost up. So it's the same with the organization. They don't realize that they're almost out. And then who's going to take the place? Clearly, younger generation. And until that completely shift has happened, we will not see a major change at the workplace. Just so what they do at the moment, the Titanic is sinking, and they're buying minutes only by pumping with a small pump the water out. But the Titanic was the biggest ship in the world, even the biggest pump, only buying time. It doesn't, colmate the breach that you have in the keel. So that will not happen, and they're still sinking by the nose. Nike again, that's not the only one. Many have sink by the nose and are sinking by the nose. Not because it was a bad brand, not because the products are bad, it's because they're lacking the vision to address the new generation, not only in product, but also in the workplace. Because no one wants to work for you today, young generation, if you damage the environment. That's the first concern. They don't want to work for more than 3 years in a company because they don't want to spend their lifetime like their grandparents used to do in a company. They have a plan for themselves. They 2 years there, 1 year there, 6 months there, 2 years there, 1 year there, and I get to my personal goal. So even if it's the best employee in the planet, I'm going to stay 3 years max. The turnover in the Silicon Valley is 6 months. Apple, 6 months. Google, 6 months, a year maybe, if lucky. So just to put a name on a resume, and then gone. Many don't like the culture. Many don't like. So what can we do? We can make awareness and propose solution to rechange the company culture. A culture. What's a company culture means really? It means the way we do things around here. So it's a bit like if I invite you for dinner, okay, at my place, or you invite me to India and you say, okay, when you come to India, okay, in my home, coming from North America where they don't take the shoes off, I do, but I mean, most people, the first thing you do, you take your shoes off because that's my rules, my house. We don't sit, for example, in Japan, we don't sit on a table. There's no table. We sit on the floor and we have just a small table. Or in Thailand, we put everything on the floor, literally on the floor. You don't like it, but then
So
don't come to my place. Exactly.
In India also, yeah, we sit on the floor for.
Exactly. And it's part of the culture. So what's the culture is the way we do things around here. And so companies have a company culture, which is another way to say, okay, when you work at our company is the way we do things. But that way to do things is out of the window. Because the way you used to do things, Mr. Company, are not followed by the young generation. It's a bit like if I come to your place in India and you ask me to take my shoes off and sit on the floor and be polite and bow and things like that, and I say I would do none of that. Then I understand in a way the manager today, the owner, the CEOs, they say, well, they think it's a disrespect. But when you have everybody wants to do something else, either you work by yourself or you will have to change the culture. In the workplace, it's more flagrant than ever before. They don't want to buy the package that used to be recycled generation after generation. I'll give you one example quickly. Air Canada, company I know quite well, they used to recruit a lot of people in the 70s, 80s, okay, and they have enough people for a lifetime because remember at that time, people were staying for a lifetime. And of course, 40 years later, those people were about to retire. So in prevision, 2020, in prevision of this 40 years retirement from 1980 to 2020, they decide to reopen the door, okay, massively to replace that generation that's about to replace. And the package they offer was the exact same than 40 years later. 4 things. 1, the price has changed. 2, the generation has changed. 3, what they used to find attractive, is shabby at best. And 4, they couldn't find anybody for that price and package. They didn't get it.
Same
and other people.
Same as in India.
Mm-hmm. So our role to make the sorry to talk too long, but because it's fascinating, I'm very fascinated by this subject. Our role is to try to explain to them that either they change or they go down by the nose. It's on off. There's only two options here. You adapt to life, and that's what life is all about. You adapt or you're gone.
Yes. Yes, very true. So, and if that can happen in a Western countries who are progressive and developed as compared to India, imagine what is happening in India. I mean, yes,
Mm.
you said it rightly. Generation Z in India is struggling with mental health issues, especially during COVID. Students of all ages, and who are between 18 to 24, the Gen Z, they struggle a lot, and they are the consumption of anti-anxiety, antidepressant, had gone up. It's still up. They are struggling with the. So it's unfortunate that they had to face this at the start of their career. All the chaos, it's not a stable start for a good start for any career. So yes, Gen Z is struggling, but also they are open to express themselves, that they are facing issues like depression or anxiety, or they're feeling overwhelmed because of the stress. Like you said, they are open, and I mean, they can say directly to their managers that I don't want to do this. I want to
Mm.
do this much only, and
Mm.
I'll stop here. So many older generation people have told me that, Vrushali, these people, they don't take up call after 5 o'clock or after 6 o'clock. After work hours, they don't want to work. I said no. You used to call us like 8 o'clock, 9 o'clock, but that is, I mean, intimidating, right? I mean, you can't call someone after office hours like 6, 7. But for these people, especially bureaucratic mindset, or this very orthodox mindset in India, it is very difficult to digest all these issues. And second part for India would be, at least I can say for India, there are a lot of superstitions about mental health. And
Yeah.
mental health, or psychology, it is considered to be a Christianian, something comes from Christianity,
Mm.
something which is not from our religion, our cultures. But because of COVID, I guess a lot of people have faced, even seniors also face, and they have started acknowledging this mental health. And so there is a slight change in the mindset of people, that they are open to discuss, but still organization are not ready to spend money, because they don't see the
The emergency, the urge for that. Yeah.
ROI, return on investment. Either there is some, either they don't want to, because see, hiring a organizational psychologist or somebody who has experience in counseling, so it's very cheap compared to a lot of activities done by organization.
Yeah.
But there is still this mindset that since COVID is over now, there is no need to do such things. It's over, so people will deal with their mess on their own. But I think, like I mentioned earlier, the trauma part and the grief part, they are taking
Mm.
toll. And yes, there are companies who have called me, and I also conducted a few sessions in last 2 months. And they are also but they are still hesitant to spend or keep a separate budget for this topic, well-being initiatives, which is, I guess, it's a very wise investment for any organization, because mental health is directly related to the productivity part, because it's depression and anxiety and stress, they impact our mood, they
Mm.
impact our the emotional stability.
Mm.
So somebody who is dealing with the emotional, unstable emotional issues, he or she will not be able to focus properly. That will impact, the first part will be work. Okay, so the person will not deliver as much he or she can. So first part is, of course, the work productivity. So this ROI part is again, maybe they don't see something directly, or they don't want to understand. Like you said, very reluctant, very rigid mindset, that we don't want to hear all these things or do. But there has to be some budget, and it doesn't cost much to the organization, I guess. So at organization level, yes, in India, it is still not that serious as it should be. So this is like from my side, even for the employees, I would say that employees should also ask, they should basically take advantage of whatever services are being offered. But as you know, I have worked with Siemens for a very long time and have implemented the well-being initiatives. People were reluctant by then, to explore these things, and they are still reluctant because there are so many, so many of my colleagues who are working with companies, and their companies are offering well-being, or they have a well-being budget, but these people, they don't use it for a well-being purpose. So that's the problem. So for us, obesity, hypertension, diabetes, then this coronary, I mean, heart issues. So they have gone really, really up. I mean, the percentage is really alarming. And I think I have shared one article with you that half of the India is,
Yes.
is sick, and cancer. The people getting cancer is really, going up day by day. So stress is another major cause for cancer, and
Yeah, for
we
sure.
also don't. Yeah, we also don't take good care of ourselves. The genes part is also there. We are vulnerable to diabetes and cancer, but Indians are really poor at taking care of themselves, following a sleep schedule, and then having a diet, because we eat too much of carbs, very little protein, and the obesity
They're
part.
following the pattern. I mean, people following. It takes generation to change one generation. Although it's going faster right now, most people just follow the example they received. We accept the world the way it was presented to us when we're born, and this is our norm. Whether it's correct or not, that's not me to discuss. But whatever is presenting to us in the beginning of our life, this is our base, camp base zero. Anything else is either strange or a stretch. I think now, if that base was not healthy to start with, working too long, not eating enough, not sleeping enough, drinking too much, whatever, if that base, you call it normal, it will take many generations to move that normal to the non-normal, to the new normal. And even with that, with the young generation, they copying what they've seen when they were born, when they were born, you know?
So I think that's our third point, which is building resilience and coping strategies. So I think you can start, at your side. How can
Mm.
you help people at individual level for building resilience and coping strategies?
Well, um, I did both individual level, and that's why I decided to go to organizational level, because first of all, if we go, and that's why we're missing so much psychologists. There was a crisis everywhere because there's simply not enough psychologists on this planet,
True,
clinical
true, true,
psychologists,
true,
to solve all those
true.
things. So we have to find another way to address mass problem, mass generational problem, and cultural problem at the same time. And the only way to do that is to go higher at organization level.
Mm,
Organization level means also government level.
yes. So
Uh,
that's the prevention part, right? The
so
prevention
again,
part.
sorry.
Prevention part, right? So if we
Yeah.
prevent something at organization level and government level, I think we can ease out the burden on the clinical side.
Yes. Because a clinical psychologist is a car mechanic for the
Yeah.
mind, like a doctor is a car mechanic for the body. We don't go to a car mechanic if the car works really well, but we only go there when it stops functioning, or there's a sound that shouldn't be there. So we're still repairing the human body and mind instead of taking care of it. So there's no prevention, very little prevention at the moment. We, yeah, we mainly see the problem when the problem is already there. We don't want to see as it built. So the only way to address is a bit like I compare to plastic bottles. You know, for many years, decade, there was campaign, at least in the West, Europe and North America, to recycle the bottles, the glass bottle, the plastic bottles, the can, you know, the cardboards, everything. And we do, but that helped about 3% of the recycling after 40 years. So it took 40 years to educate the people, 40 years, and with all the recycling we do, that helped the problem 3%, maybe 4%. So there's another way to address the problem with plastic. It's no plastic. Then you don't have to worry about education. You don't have to worry about anything else. You remove the plastic altogether. They won't throw the garbage because there is no garbage to throw. Better this way than to try to we try the education part, and that worked for 3%, as I say. So it's the same thing for the workplace. We can't try to educate one by one and, you know, please take care of the people and things. Well, there's another way. we avoid the problem altogether, and the only way to do that is to prevent that to happen.
That is also cost effective.
Of course. Yeah. It's cost effective for the company, first of all. It's better for the community. It's better for the environment. It's better for the products they're doing and the image the company has. It's better for the state that will have to spend so much money on taking the tab, repairing those broken mind and broken body. It's just common sense.
Yes.
Common sense that I don't see very often. When I explain that to a kid, he said, yeah, that makes sense. The kids get it. But the kids, compared to a politician or to a CEO, have something that they don't have. And that is money. A kid don't care about the money. So they only look at the obvious solution. Apparently, the money make the people think differently.
Yes. So I think that that is something start of our next point, which is how will you foster a communication or environment where people can communicate about their mental health and ask for support or give support.
So what we're trying to do, I mean, with the organ psychologist, is try to establish in any company we work with a safe place to work. Safe place is not only physical safe place where, you know, the machinery are correct and you wear the helmet or you wear the steel shoes, you know, and whatever. This is, yeah, that's part of the safety. But we're talking about the psychology safety place where if you do mistakes, if you have a question, if you have any comments to do or any improvement you would like to do, you shouldn't be afraid to open your mouth and say it. You shouldn't be afraid of who you are, where you're from, your social level, or your gender, or your sexual orientation. All that has nothing to do with the workplace. It should be our religion. A person is a person and has the same rights to express. But if you know that if you open your mouth for criticizing, saying something, even open criticizing, I mean, it could be not necessarily a negative criticizing. It could be like, well, we could do like this, but we could do maybe better this way, you know? If you know that the minute you say that you're fired, then you don't say. So the first thing to do is to make sure that the workplace is a safe place to speak and to make mistakes, because the only way, there is a very good example in India that I know of, and I told you about that offline, was this, the clinic for the poor in Bangalore, set up about a few years ago, right? They managed to recalculate the price and they offer very cheap operation or for free for those who cannot even afford it. Now the operation it's with the same equipment and with the same qualification that if you were in the United States. Same, exactly. The difference is there's so many people, because it's affordable or cheap or free, that the surgeons are doing the same operation 100 times more than a surgeon pay millions in somewhere else, in Europe or in thing. That make the surgeons also the best practitioner. And so the best surgeons are in Bangalore because they practice not once. Usually they have like a special kind of operation once a year or twice a year. You know, they're doing tens a day, every day. So after a year, they have like the whole career behind them compared to a very qualified, supposed qualified. So by doing something repeatedly, you become better at it. So
Yes.
this is on the same example. This is one do like by opening up the channel of discussion and making a safe place, then you can become a better workplace. That means a better company. And so when everybody thrive, people don't leave you, they work for you, they appreciate you, you appreciate them. And what do you think will happen to the economy of that company? It's going to go on the way up, not on the way down. You're going to even attract people to come and work
Yes.
for them.
Yes. Yes. So this, for at least from my side, what I would like to say is, at least for India, there has to be a lot of awareness should be created in the regional languages, because English content is available everywhere, and it's for international audience, and but it has to be customized for regional audience. For, like, there are so many local languages in India,
Yeah.
and if we can communicate all these things, like I attempted through my first book, and also the second book is also coming. So if we can, at least those who are listening to me who are from India, they might think about it, that addressing mental health issues in their own mother tongue is much easier than saying something in English or expressing something in English or some foreign language. So the communication part, more and more people should be able to express themselves or about their mental health challenges in their respective mother tongue. And so in that way they can ask for support also, because most people in India, they don't, especially those who are not privileged like us, those who don't have access to all these counseling and therapies. So if they find some good movies or some documentaries in their own mother language, or books, or some videos, I guess that is where they will start understanding what is happening to them. And it's very difficult in India. I mean, Patrick, I mean, you come from a very
Yeah.
you come from a developed country. You are privileged compared to, even to me, because though I'm privileged in India, but I see this tremendous poverty, and then there is a trauma, and then addiction part. So all these things are they are biggest challenges. So to create awareness, and once awareness is there, then people can ask for support, and they will not suffer in silence, because there are so many mental health issues and so many suicides. Frankly, the number is very dangerous if I say, but as per my knowledge, it is 2 suicides per day in India,
Right.
which is and at least in
Yeah.
my own region, Maharashtra, yes, it is. These are the numbers: 2 suicides per day, and especially young people. So COVID has really impacted our whole psyche and the whole life. It has turned our life ups and down, I think, by 360 degree. And
Yeah.
those who couldn't cope up, they are having symptoms. They're not able to understand what is happening with them, and then something happen. They get into addiction part, or they get into all these things which they should not do otherwise. So I think communication, like somebody that day shipping me on WhatsApp, that Dr. Vrushali Raut. I said yes. And are you a psychiatrist? I said no. Then she sent me request on Facebook. And then by the evening, one of my friends says that, ma'am, I have, I have referred someone. I have given your number. So that lady, she didn't message me back, can you help me or something like that. But she had sent me request on Facebook. I mean, this is not the way you communicate in general, right? I mean,
Mm.
if there is a need, then you can directly should ask, I mean, what is the time? When can I call you? The communication part is something I guess we all have to work on, at least for Indian context, I can say. So
Mm.
this is from my side, and the last point is again recognizing and addressing mental health challenges. I think we have covered this point, but still, you can
Yep,
add some points.
that's good. Yeah, a lot of comments, a lot of things to talk about. Do you think we have any questions, or isn't
It's
is that more?
recognizing, addressing mental health challenges in the workplace. That's our last point.
Okay.
So would you like to add
Addressing mental
certain?
health in the workplace. Um, yeah. Again, a vast subject, but to make it short, there is already what we call an EAP program in most big organization. At least in the eastern part, in the western part, sorry, the employee assistance program, where you can seek the help of a psychologist if you feel struggled. It's paid by the employer. I know that many companies in India also have this program. Um, it's only used, however, by 2 or 3% of the employee. There's a mistrust. There's fear that somehow the information will
Taboo.
leak
The
to
taboo part is also there.
the taboo part, but also the fear that the information given to the psychologist will not be confidential in the percent, and it could be used by the CEO or by the C class to,
HR
you know,
especially. HR
yeah,
should
yeah,
be educated.
exactly. So the trust is not there with this program, and it's not new because the program has been existed in 20 years, and EAP has never been more popular than, let's say, 5% of the workforce. So it's time we create, and that's what I'm doing with my organization, the Leader of Tomorrow Institute, trying to create the next step after EAP program. So from the 80s to the year 2000, there was like stress management course. That was it. From the year 2000 to the year 2020, or just before COVID, it was EAP program. It still is, but I think that time is off. And I am trying to create what's coming next. So 20 years, trying to create the new solution. A solution adapt to the new generation, to the new change, to the new normal, and what we need at the workplace. That's what we're
So,
busy with.
yes. So, since we are moving towards the end of this session, can you tell us a little bit about your organization and the kind of initiatives you have been associated with?
Yeah. So Leaders of Tomorrow Institute. Uh, if you look for the internet, you have to write the whole thing. There's plenty of Leader of Tomorrow. You have to really write on Google, Leaders of Tomorrow Institute, and then you find me immediately. What we do, we're doing training courses of another kind. The 5.0 kind of training courses for HR, the way we recruit, the way we lead, the way we manage, the way we work with a remote team, and all these things. So everything we just talk about, the topic. That's one part. The other part, we have created a new package for mental health at the workplace that we call BrainMark,
Okay.
which use AI technology, measurement tools, assessment tools. There's two types from two different partners. And then we add our expertise on top of the measurement. So this time we're measuring physically what we say. So when we say you stress, it's not a self-assessment as is common today. We're measuring. So one of the tools is measuring straight from the brain in 6 minutes, and we got 9 biomarkers. The other tools is using a survey, but it's an AI-powered survey. Both are AI-powered tools, by the way. But the other one is AI-powered tools of self-assessment to precisely go to the mind, body. More than that, they're asking you, when you join a company, you might have a plan to stay 3 years and then to go somewhere else. They're asking you if you still on track, of they're asking you if you think the company you choose to work with is still on track to what you want to achieve in your career, not only with them, in your life. So there's a lot of very good tools there. We measure that, and then we come with numbers, Think Crush, very precise numbers. It's all backed by science. It's not something, it's 10-year study behind by very serious team. And then we get numbers of stress, of burnout, of things, of so many other, and then we can address, because it used to be that company, when you say, let me help you, they used to say, help? We don't need any help. We don't have any problem. And we used to have problem in the COVID, but COVID is gone. So no more problem. And then by measuring it, we say, well, says you, because say your staff, and not the staff, their brain, straight from their brain. This is what they think. And say, oh, yeah, oh. So again, let me help you.
Okay.
So that's
Great.
mainly what we do.
Yes. So that's very interesting. I'm quite excited about. I keep on reading your post on LinkedIn, so I look forward, to experience it myself sometime soon. Let's see how we can do that. But it was
Takes
really
time. It doesn't go as fast. It doesn't go as fast as I wish, because there's a lot of resilience. There's a lot of door to be opened to get there. So no, it doesn't go as fast as we hope, but it's going. I've got many company with open ears now. Now they're listening.
Yes.
So that's good.
Yes. So I guess it was a great session, and as usual, I learn a lot of things from you. And I think we can ask if anyone who has joined has a question. Because if they have a question, we can take question. Otherwise, we can, say goodbye. So anyone who is listening can just, message their question. They can add a comment. We will try to answer.
Anyway, you're going to post that thing later on, right? Yeah.
So because there are people I can see, and some of them are.
If not, if you post that on LinkedIn, on Instagram, then they can always ask a question later,
Yes.
And then we can try to respond to them.
Yes.
Absolutely.
Yes. So Patrick is available on LinkedIn only. He is not present on Facebook or Instagram. So he has joined this session through his wife's account,
Correct.
and it was
Yeah,
quite.
I'm not.
Yeah. So
I'm not
you can.
let's say I'm not a meta person. Everything the meta produce. Actually, I'm on WhatsApp, but WhatsApp used to be away from Meta. But I'm not a Meta person, so whatever Meta do, I'm not on it usually. I'm on LinkedIn, yes.
Yeah. So
and of course my website.
Yeah, you can always reach out to him through his website, or
Patrick Bensen on LinkedIn. Find me, add me. I'm always adding people every day. Today I had 2 ministers today. Today I'm glad I had 2 ministers, one from the Czech Republic and one from Singapore. Very nice.
Oh, nice. So it was great talking to you, Patrick, today. And I hope to see you once again, maybe, with some different topic related to organizational psychology. And
Yes.
Have a nice day ahead.
I thank you so much for your time, all of you. And thank you, Vrushali, for making this possible.
Yes. Okay. See you then.
All
Bye.
right. See you then. Bye-bye.